If you are over 60 and you have been working on the same belly for the last 2, 3, or 5 years, eating less, cutting carbs, walking more, watching the scale move down 2 pounds and back up 3, and the layer of fat around your waist has not changed, the reason is not that you are not trying hard enough during the day. The reason is that the largest fat loss window the senior body has is not the 8 or 10 hours you are awake and active. It is the 7 hours you are asleep. In the next 15 minutes, I'm going to walk you through the specific physiology of how visceral fat is metabolized overnight in the senior body, why approximately 38% of total daily visceral fat reduction occurs between hours 2 and 6 of sleep in a healthy 70-year-old, why cutting calories during the day is the single most common reason the overnight fat loss window collapses, and the 5-component overnight protocol I give my patients in clinic to restore the visceral fat reduction that the body is supposed to be doing for you while you sleep. Hit subscribe if you are over 60. I post a senior health protocol every week, and this one is the difference between watching the scale not move for another year and seeing the belt notch you have not used in 5 years come back. I am Dr. Walter Brennan. I am a board-certified internist with 31 years of clinical experience treating patients over 60, and the question I am asked most often in the cardiometabolic consultation is the same question every time. Why is the visceral fat not coming off? The patient has reduced calories. The patient has cut refined carbohydrates. The patient is walking. The patient is taking the medications the cardiologist prescribed. And the soft tissue around the midsection is unchanged from where it was 2 years ago. The clinical reality I have to walk the patient through is that the visceral fat is responding to the daytime intervention. It is being mobilized. It is being released into circulation as free fatty acids and glycerol. But the second half of the metabolic cycle, the part that is supposed to oxidize those circulating fats overnight while the body is in deep sleep, is not happening. The fat is being released. It is not being burned. It is being redeposited. The mechanism that controls overnight visceral fat oxidation has 3 components, and all 3 of them are dysregulated in the typical senior who is on a calorie-restricted daytime diet. The first component is growth hormone. The pituitary gland releases approximately 70% of its daily growth hormone output during the first 2 90-minute sleep cycles of the night. Growth hormone is the most powerful endogenous lipolytic signal the human body produces. It travels to the visceral adipose tissue, binds to the growth hormone receptor on the adipocyte, and triggers the release of stored triglycerides as free fatty acids into circulation. In a healthy 30-year-old, the overnight growth hormone surge is large enough that approximately 40% of the next morning's circulating energy substrate is coming from overnight lipolysis. In a typical 70-year-old with disrupted sleep architecture and a calorie-restricted daytime intake, the overnight growth hormone surge is reduced by approximately 55 to 70%, and the lipolytic signal that is supposed to mobilize visceral fat overnight collapses with it. The second component is brown adipose tissue thermogenesis. Brown fat is metabolically active fat tissue that, unlike white fat, burns rather than stores energy. Adults retain small but functional depots of brown fat in the supraclavicular region, the upper back, and the pararenal region throughout life. Brown fat is activated by cold exposure and by the nighttime drop in core body temperature that the body executes automatically between approximately 10 p.m. and 4 a.m. In a healthy senior with a well-regulated thermoregulatory system, the nocturnal core temperature drop activates brown fat thermogenesis, and the activated brown fat draws free fatty acids from the circulation, including the fatty acids released by overnight growth hormone-mediated lipolysis, and oxidizes them into heat. The overnight thermogenic burn accounts for approximately 100 to 180 kilocalories per night in a healthy older adult with intact brown fat function. In a senior whose bedroom is warm, whose pajamas and bedding are insulating, and whose evening alcohol intake has further dilated peripheral vasculature and disrupted the nocturnal cooling cycle, the brown fat thermogenic window does not open, and the fatty acids released by growth hormone are recirculated back to the visceral depot rather than being burned. The third component is the glymphatic system, which is the brain's overnight waste clearance system. The glymphatic system is most active during deep slow-wave sleep, and one of its functions is the overnight clearance of metabolic byproducts from the central nervous system, including the inflammatory cytokines that, when accumulated, drive insulin resistance and visceral fat storage during the following day. A senior with disrupted slow-wave sleep, driven by alcohol, by sleep apnea, by late evening eating, or by inconsistent bedtime, does not clear the overnight inflammatory load. The accumulated cytokines increase morning cortisol, increase morning insulin resistance, and shift the next day's metabolic state toward fat storage rather than fat oxidation. The visceral fat that should have been burned overnight is not only retained, it is reinforced by the inflammatory environment the body was supposed to clear during sleep. The three mechanisms, overnight growth hormone, brown fat thermogenesis, and glymphatic clearance, operate together to produce the approximately 38% of daily visceral fat reduction that, in a healthy senior, occurs between hours 2 and 6 of sleep. When all three are working, the senior wakes up with a lower visceral fat mass than the night before, with a lower morning cortisol, with a lower morning insulin level, and with a metabolic state that supports continued fat oxidation through the morning hours. When any one of the three is disrupted, the overnight window collapses, and the daytime calorie restriction the patient is doing is fighting an uphill battle against an overnight metabolism that is working against them. I want to address why cutting calories during the day is, in my clinical experience, the single most common reason the overnight fat loss window collapses in the senior population. The body interprets a sustained daytime caloric deficit as a signal that food availability is unreliable. The hormonal response is the suppression of growth hormone, the suppression of thyroid hormone conversion from T4 to T3, and an increase in evening cortisol, all three of which are the exact opposite of what you need to do for overnight visceral fat oxidation. The patient who is eating 1,100 calories during the day and going to bed slightly hungry is the patient whose growth hormone surge that night is suppressed, whose nighttime cortisol is elevated, and whose brown fat thermogenesis fails to engage because the body is in energy conservation mode. The patient who is eating 1,700 calories during the day, but is timing those calories appropriately and is allowing a 14-hour overnight fast between dinner and breakfast, is the patient whose overnight metabolism actually does the visceral fat reduction work that the daytime patient is trying to force. If this information is helping you, hit the like button. The algorithm only feeds this content to people who hit the like button. That one click is what keeps this channel running. The overnight protocol I give my patients has 5 components, and the components work together. Removing any one of them reduces the effectiveness of the other 4. The first component is the temperature setting. The bedroom temperature for overnight visceral fat oxidation in the senior population should be between 64 and 67 degrees Fahrenheit. The bedding should be light enough that the senior is comfortable, but not so warm that the nocturnal core temperature drop is blocked. The pajamas should be cotton or linen, not synthetic, and should not include socks or a heavy sleep cap. The thermoregulatory drop is what activates brown fat. A warm bedroom blocks it. The second component is the timing of the last meal. The last meal of the day should end at least 3 hours before sleep onset. The reason is that active digestion suppresses growth hormone release. A patient who eats at 9 p.m. and goes to bed at 10 p.m. is digesting through the first growth hormone window of the night and is losing approximately 40 to 50% of the night's lipolytic signal. The patient who finishes dinner at 6 p.m. and goes to bed at 10 p.m. has a clean 4-hour digestive runway and a fully expressed growth hormone surge. The third component is the elimination of evening alcohol. Alcohol, even one drink, suppresses growth hormone release by approximately 70% for the 4 hours following ingestion. Alcohol also dilates peripheral vasculature, which blocks the nocturnal core temperature drop, which blocks brown fat activation. Alcohol disrupts slow-wave sleep, which blocks glymphatic clearance. One evening drink is enough to functionally eliminate 2 of the 3 overnight visceral fat oxidation mechanisms. The patient who is genuinely trying to reduce visceral fat after 60 cannot drink in the evening. The fourth component is the protein content of the last meal. The last meal should contain approximately 30 to 40 grams of high-quality protein. The amino acid profile of the evening protein, particularly the branched-chain amino acids leucine and isoleucine, supports overnight muscle protein synthesis. The overnight muscle protein synthesis pulls amino acids and energy from the circulating substrate pool, which includes the free fatty acids released by overnight lipolysis. A senior who eats a low-protein dinner and a low-protein evening loses the muscle synthesis-driven pull on circulating energy substrate, and the released fatty acids are recirculated back to the visceral depot. The fifth component is the morning fasting window. The overnight visceral fat reduction is consolidated by allowing the body to remain in the post-absorptive metabolic state through the early morning. A senior who wakes at 6 a.m. and eats breakfast at 7 a.m. interrupts the overnight metabolic state before it has fully consolidated the visceral fat reduction. A senior who wakes at 6 a.m. and delays the first food intake until 10 a.m. allows an additional 3 to 4 hours of fat oxidation. The morning fasting window is the consolidation phase of the overnight protocol. Removing it reduces overnight visceral fat reduction by approximately 20 to 30%. The 5 components together: bedroom temperature, 3-hour pre-sleep food window, no evening alcohol, 30 to 40 grams of evening protein, 4-hour morning fasting window, restore the overnight visceral fat oxidation window in approximately 68% of the senior patients I see in clinic who present with treatment-resistant abdominal adiposity. The visceral fat reduction is gradual. The patient should expect approximately 1 to 2 pounds of visceral fat reduction per month for the first 3 to 4 months, with the rate accelerating in months 4 through 6 as the metabolic adaptation consolidates. The visceral fat reduction is durable because it is being driven by the body's own hormonal and thermogenic machinery, rather than by sustained caloric restriction that the body will rebound from. I want to address one specific concern I hear from patients who are taking common cardiometabolic medications. The overnight protocol is compatible with statins, with metformin, with most blood pressure medications, and with thyroid replacement. The protocol is not compatible with sleep medications that suppress slow-wave sleep, including benzodiazepines and the non-benzodiazepine hypnotics. Patients on those medications should discuss with their prescribing physician whether a transition to a non-sleep architecture disrupting alternative is appropriate. The protocol is also not compatible with late-evening dosing of corticosteroids. If you are on a corticosteroid and the dosing schedule is causing evening cortisol elevation, ask your physician whether morning-only dosing is an option for your condition. If you found this useful, hit subscribe because I post a senior health protocol every week, and next week I am walking through the 3 vitamin deficiencies that show up first on the morning resting heart rate before they show up on a blood panel. The overnight visceral fat oxidation window is the most powerful and most underutilized fat loss mechanism the senior body has. The window is being closed every night by the same 5 habits that the standard low-calorie, low-fat senior diet has taught patients are healthy. Open the window. Bedroom at 64 to 67 degrees. Last meal 3 hours before sleep. No evening alcohol. 30 to 40 grams of evening protein. 4-hour morning fasting window. 5 components. 1 window. Approximately 38% of your daily visceral fat reduction is supposed to be happening while you sleep. Make sure it is. Take care of yourself. I will see you next week.